Thanks so much for joining, everyone. My name is Dr. Terrie Van Alstyne. I'm a naturopathic doctor, and my website is corehealing.ca. And I practice in downtown Vancouver, in Yaletown, and in North Vancouver, and I live in Whistler. So we want to create hormone harmony. Hormones are super important. They regulate everything in the body. They're chemical messengers that send signals and to receptor sites on every cell in the body. So every system requires hormones to function properly. And our lifestyle, our diet, exercise, and toxin exposure, as well as our thoughts, beliefs, and perceptions, all impact hormone levels. So we're going to talk about menopause. Menopause generally hits us at around age 48 onward to 55. Usually it's when your mother went through menopause is when you do. I was 49. It lasts 5 years, and the definition is you cease to menstruate for 6 to 12 months. And generally, all of these hormones drop. So estrogen, progesterone, testosterone, human growth hormone, DHEA, pregnenolone, and melatonin all drop. And this can create hormone imbalances. And the glands and organs involved are the pineal, pituitary, and hypothalamus, which are all in the head, and the adrenal glands, which sit above the kidneys, that are the body's battery, the thyroid gland, and the pituitary and the liver specifically. Those four are all connected. So why is there a problem? Well, what's happening is often that medical doctors are treating hormone imbalances with antidepressants, and they're not addressing the hormones. And I know that because a study was done a while back where they took a large group of women and they gave them hormone replacement therapy, and they had to stop the study because so many of them were having strokes, heart attacks, and were getting breast cancer and other estrogenic cancers, that they realized that hormone replacement therapy was dangerous. So now they're afraid to do anything. And they know that like progesterone might be okay, but definitely estrogen is an issue. So estrogen causes cellular proliferation, which can lead to cancer. So the other problem is that elevated cholesterol is an adaptive response to low sex hormones. And what doctors are doing is trying to lower the cholesterol with statin drugs, which cause even more problems, and including liver failure. So also, cholesterol is the central molecule of every hormone. And if it's lowered, we can't produce those hormones. So there's a lot of problems going on. And as you can see, elevated cholesterol is also caused by damage to blood vessel walls, which is impacted by sugar, trans fats, lack of essential fatty acids, and lack of antioxidants. So this is just a study that was done showing how estrogen receptors are impacting postpartum depression. And so the conclusion of the study was that postpartum depression can be predicted in all women as early as the 3rd trimester, and prevention of excess estrogen exposure and treatment of high estrogen levels can be implemented to avoid postpartum depression entirely. And this should be done because it is such a horrible impact on the baby and on the mother. So estrogen is playing a role in postpartum depression. There's a lot involved in endocrine dysfunction or hormone imbalance. There is whether the glands that are producing those hormones are working properly, whether the tissues that are receiving those hormones are responding properly, whether our adrenal glands are functioning properly, whether the hypothalamus, pituitary, and adrenal glands, there's an axis where they're all connected, whether that's running properly, whether we're under a sympathetic fight or flight situation, whether there's systemic inflammation in our bodies, because that's going to impact whether hormones are received properly, whether we're so toxic that the toxins are blocking the hormone from functioning, whether our blood sugar is regulated or not, and whether there's energy within that hormonal system. So all of these things impact. And the best testing methods are with saliva and urine, not blood, yet medical doctors only do blood tests. So that's not accurate. And so naturopathic doctors are able to solve that problem. So we do a CHI urine test is one of the best ones out there. So what causes menopausal symptoms? Well, the adrenal glands, which are our battery that secrete cortisol and adrenaline, the stress hormones, they are supposed to take over production of estrogen and other hormones from the uterus and ovaries once we stop menstruating, once we stop producing eggs. And if those adrenal glands are weak from a lifetime of excess stress, not eating regularly, no routine in our lives, overworking, etc., then they can't take over that production of hormones well. Also, if the liver is under functioning because it's been exposed to too much of a high protein, high fat diet, too many toxins in the body, that's going to impact our hormone production. And if our thyroid isn't functioning properly, and I'll go through reasons for that, that's also going to impact whether we have a smooth menopause or not. So symptoms of adrenal exhaustion you can see here. And low sex drive is certainly a key one. And also low energy in the morning, which increases over the course of the day to be high in the evening, which is opposite to what it should be. So I created a stress and adrenal support formula, and you can read about it on my website. It's a powder. I like powders because I can get a lot more into a dosage that way than in a capsule. And so it's a combination of all of these herbs, vitamins, minerals, and amino acids, all to support the adrenal glands, to give the adrenal glands energy, and to lower the stress hormones. And so this is a list of all of the things that the stress and adrenal support formula is affecting and balancing. And now the thyroid gland. So the thyroid gland is here in the throat, and it's primarily involved in growth and development and increased metabolism. Basically the speed or rate that everything functions at in the body. And so hypothyroidism is more and more common, and it can be caused by a number of things, such as a virus, dental issues, hypothalamic pituitary issues, severe iodine deficiency, negative emotions or signals like afraid to say what you think or feel. Radiation impacts it, and hormones impact it, as many women after their pregnancies become hypothyroid. And so, as I mentioned, low thyroid function affects the rate and speed that everything functions at in the body. So it will all slow down and not work fast and well enough for the body to feel normal. So it can cause, hair loss, dry skin, a hoarse voice, constipation, weight gain, coldness. That's a key symptom, is chilliness. When everybody else is normal temperature, you're cold. Depression, so many things the thyroid is involved in. And in fact, just like vitamin D, thyroid hormone receptors are on every single cell of the body. So that tells you how key the thyroid is. It's impacting every single thing. And so I created a thyroid support formula to feed and support the thyroid gland. And you can read about that on the website. And now the liver. So this is what the liver looks like, and the nutrients needed are on the bottoms of each of these sides of the liver. So you can see there are some really important nutrients that we need to be getting into our diet on a regular basis in order for our livers to function properly and detoxify properly. So the liver is involved in 2,000 daily functions. It metabolizes and breaks down hormones once they've done their job, and aids in their elimination. And it does many other things. So if estrogen is not broken down properly, this can lead to estrogen dominance, and I'll talk about what those symptoms are. Same with testosterone. If it's not broken down properly, this can cause high testosterone and those symptoms caused by that. And also, if a person's been exposed to high levels of toxins like alcohol, chemicals, heavy metals, and haven't done any detoxification in their life, this will impact how well the liver functions during menopause. And so I created a core healing heavy metal extractor and a detox powder and a core healing anti-aging detox program. So that's a comprehensive program that I have groups of people doing. So estrogen dominance is when estrogen is too high in the body. And so these are some of the causes: poor liver function, insulin resistance, exogenous hormone regimens. So that's like birth control pill, for example, as well as hormone replacement therapy, the conventional form, and environmental pollutants. So plastics, also medicated meat and dairy, like non-organic. And so risk factors are age, obesity, stress, poor diet, and caffeine, alcohol, and smoking. And symptoms that estrogen dominance causes are blood clotting, depression, hair loss, and allergic reactions. And so we need to, and we can lower high estrogen with herbs, actually. So again, list of all of the symptoms of estrogen dominance, but the key one is cancers, all cancers of all the female organs. So that's breast, ovarian, uterine, and vaginal. And so two products that we carry at the clinic are DIM enhanced and calcium D-glucarate, and both lower estrogen levels very effectively and safely. So estrogen deficiency is caused by a genetic predisposition, abnormal gland function, hysterectomies, radiation therapies, and taking hormones such as progesterone. And interestingly, excessive exercising can cause estrogen deficiency. It can also cause testosterone excess. So the symptoms are listed: bloating, fatigue, dizziness, hot flashes, and breast tenderness. And again, here are all the symptoms of estrogen deficiency. And as you can see on the bottom, more wrinkles and less skin tone, something we definitely don't want. And so by taking bioidentical estrogen, if you are for sure estrogen deficient, this will help prevent the aging process as far as the skin goes. But urinary incontinence is another one. That's when you sneeze and you lose urine, or you laugh and you lose urine. Another sign of menopause. Progesterone deficiency causes poor bowel or liver function, thyroid imbalance, environmental pollutants, and exogenous hormones again. And so the hormones would be estrogen causing lowered progesterone. Risk factors are age, stress, smoking, and alcohol. And symptoms are high cholesterol, migraines, weight gain, and allergies. And here again is the list of symptoms of progesterone deficiency. Mood swings, irritability. And this is in a man what normal testosterone versus low testosterone, how that's impacting. In a woman, the signs are acne, voice changes, hirsutism, and oily skin. That's high testosterone. Depression, aggression, lack of well-being. And then, yeah, as I said, excess exercise can cause high testosterone and will come out as acne and aggression potentially. So again, here's the list of all the symptoms for high testosterone. Voice deepening is also a symptom of hypothyroidism. And signs and symptoms of low testosterone, which is more common in menopause. Loss of muscle mass, low libido, hair loss and thinning, and fatigue. Depression, low self-esteem, memory lapses, anxiety. Okay, so dietary factors affecting menopause. Basically, the aggravating foods are excess carbohydrates, you can see the list, as well as estrogenic foods. As I mentioned, medicated meat and medicated dairy. So this is non-organic meat and dairy, and it's because it's full of concentrated pesticides and herbicides from sprayed on the grains that the animals eat. And so it's concentrated in the meat and in the fat in the dairy. And those pesticides and herbicides are estrogen. They're called xenoestrogens. Alcohol, specifically beer, is a xenoestrogen as well. And helpful foods are phytoestrogenic foods. So it's a weak estrogen that binds to the receptor so that the stronger estrogens don't bind. So kelp, soy, fermented soy, fennel, celery, parsley, nuts, whole grains, and apples are all phytoestrogenic. And soy isoflavones have proven to prevent cancer, gallstones, protect kidney function, stimulate bone formation, lower cholesterol, inhibit LDL cholesterol, and atherosclerosis. So menopausal symptoms worsen or are more pronounced if a person is hypoglycemic, which often coincides with being overweight. So we need to be eating regularly, every 2 hours, something. Ideally, plenty of fruits and vegetables, but nuts and seeds and, all of the healthy forms of protein will balance the blood sugar. So if you're hypoglycemic, which gets worse with age, you can't skip a meal. You may have headaches, irritability, angry, can't focus. So make sure you eat vegetable protein with breakfast and lunch, and potentially 4 ounces of animal protein or another vegetable protein at dinner. And so the protein sources are meat, fish, nuts, seeds, beans, and rice combined, or beans with quinoa, or millet, protein powders like pea, rice, hemp, chia, nut butters, eggs, and quinoa. Avoid sugar, bread, cakes, cookies, junk food, spicy foods, coffee, caffeine, a low-carb diet, and alcohol. Those all are not good for menopause. And eat unprocessed grains. You want whole oats, millet, quinoa. And chromium is a mineral that helps balance blood sugar. And eat plenty of fruits and vegetables every 2 hours, ideally. So integrative hormonal health. So optimal function of hormones is dependent on many interrelated factors, such as a zinc deficiency is going to impact hormones, a B6 deficiency is going to impact hormones, and cause an imbalance, and a magnesium deficiency and other nutrient deficiencies as well. E, A, D. So hormone dysfunction is associated with all disease processes. As I mentioned, hormones are chemical messengers for every system in the body, every cell in the body. So an inconsistency between symptoms and levels is a sign that target cells do not listen or are not receptive to the hormone. And these are the key nutrients needed: multimineral, a B complex, B12, magnesium glycinate, and omega-3 fatty acids. So omega-3s, they're important constituents of cell walls. They're anti-inflammatory. They're required for cell metabolism and for cytokine production. Cytokines are involved in inflammation. And we do have a ratio of omega-6 to omega-3 as 3:1, but in North America, it's actually 25:1. So way more omega-6s than omega-3s. And you can see omega-6s are inflammatory, whereas omega-3s are non-inflammatory. Krill oil is the best one for hormone balancing. Krill is the tiny little fish-like organisms in the ocean that whales eat, for example. So if inflammation is present in the body, which it normally is, we should be taking 2 to 4 grams of omega-3 oils. And if there's a neurological disease, up to 10,000 grams a day to help heal the neurons. Omega-3 fatty acids are phenomenal. They reduce or they help prevent macular degeneration. They decrease the risk of prostate cancer. They're as effective as nonsteroidal anti-inflammatories for arthritis. They're as effective as lipid-lowering drugs without the side effects like decreased cognition and memory. And I had a patient who became paralyzed from these lipid-lowering drugs. They're equal in potency to standard blood pressure drugs and actually address endothelial dysfunction, the inside of the blood vessel walls that are damaged. And amino acids EPA ratio ideally is 1.5 to 3 to 1. To have that kind of a ratio, we can see a 25% reduction in cause mortality. Vitamin D3. Well, D is actually a hormone and our bodies produce it from sunlight. But there are some food sources that we can get it from as well. And the list is on the right. And a deficiency is prevalent at our latitude without supplementation in the winter. And even though Health Canada says 1,000 IUs per day is a daily dose, what the studies have proven is that we need 6,000 to 8,000 IUs per day in the winter, or if we're in an area where there's not enough sunlight. So deficiency symptoms include cancer, macular degeneration, asthma, pneumonia, osteoporosis, MS, inflammatory conditions, depression, and diabetes. And if vitamin D is low, then our tumor necrotizing factor, which is a key immune fighter for cancer, is low. So 5,000 IUs per day is what we need to decrease our risk of cancer. So how are hormones made? Well, cholesterol, as I mentioned, is the base molecule of all hormones, and therefore a deficiency of cholesterol will lead to a deficiency of all hormones and brain biochemicals, including serotonin, which is the feel-good hormone. And when serotonin is low, we are depressed, anxious, and have insomnia. So cholesterol is produced and deposited on the arterial walls to patch up damage. And so By lowering cholesterol, we're not treating the cause of why it's being produced in excess. So we need to heal the damage and avoid the foods that cause it. Statin drugs do not prevent heart attacks. They cause a deficiency of coenzyme Q10, which is what protects us from heart attacks. And a deficiency of CoQ10 leads to heart muscle weakness, general muscle weakness, and can cause liver cirrhosis. As I mentioned, one of my patients when I had a clinic in Qualicum Beach was paralyzed from a lack of CoQ10 caused by statin drugs. Hormone replacement therapy, as I mentioned, is very dangerous. It proved to cause breast cancer, heart attacks, and strokes. And that is for sure when it is given unopposed, which means just that estrogen without the progesterone to counteract it. And estrogen causes cellular proliferation, or excess cell growth can develop into tumors. These are some versions of hormone replacement therapy, the estrogens and the progesterones. And estrogen, HRT estrogen is made from pregnant horses' urine. So it's much more concentrated than the human version. Bioidentical hormones are synthesized from diastenin, which originates from Mexican yam and from non-genetically modified soy. It's considered human identical because it looks just like human hormones. And as I mentioned, they're often in cream form, but not always. So estrogen and testosterone are given in cream form. Progesterone may be, or it may be in pill form. And unopposed estrogen, either with hormone replacement therapy or with bioidentical, can lead to all of those blood clots leading to heart attacks and strokes, pulmonary embolisms, deep vein thrombosis, as well as cancers. So it's always super important to test your hormones on a regular basis with urine or saliva to keep track of where you're at so that estrogen never gets too high. And Douglas Labs is a professional company. We carry their products at the Yaletown Clinic, and they have some great hormone balancing formulas like Estromen, Progesterone, Testogain, Testoquench, Dim Enhanced, Calcium Deglucarate, Seroplus, Dopaplus, NeuroPure, 5-HTP, melatonin prolonged release, and PMS support. And they're all herbal and nutrient based. James Greenblatt, medical doctor, he formulated these 3 products. They're called the Pure Synapse group: Dopa Plus to raise dopamine, Seroplus to raise serotonin, and NeuroPure to raise both. And they encompass mostly nutrients, the precursors of dopamine, serotonin, and the NeuroPure combines both. So they're phenomenal. And I created these formulas all in powder form to go into smoothies: a detox powder, a heavy metal extractor, a thyroid support formula, a stress and adrenal, hair, skin, and nails, immune and antiviral, antibacterial, and a digestion healer. And so, as I mentioned, toxicity can be a component of the liver not functioning properly and therefore not working well enough during menopause, creating menopausal symptoms. So enhanced detoxification with these powders, or ideally doing my detox program for a really comprehensive approach to getting all the toxins out of the body so that the liver and cells are functioning properly and hormones are balanced. The thyroid support formula, as I mentioned, the thyroid addressed if it is under functioning, because the body won't be able to produce the amount of hormones that it should, even in menopause. So I have my thyroid support formula, but patients may need to go on a sustained release T3, T4 thyroid prescription to address that imbalance. The stress and adrenal support helps support those adrenal glands, which are taking over from the uterus and ovaries when we hit menopause. Hair, skin, and nails just makes us younger and better looking, and gives vitality to our hair, skin, and nails. All nutrients and herbs in these formulas. Immune, antiviral, antibacterial. Great idea during a pandemic such as the one we're facing right now. And digestion healer for anyone with digestive issues. And of course, the gut is where we get all of our nutrients from. So if there are holes in it, if it's not functioning properly, if there's inflammation, that will block the absorption of nutrients, and that needs to be healed. These are some cases just showing how effective some of the medications are that I talked about in hormone balancing. As a naturopath, I also provide nutritional IV therapy, and I add glutathione to it, which is an antioxidant, immune booster, and detoxifier. And I do it as a push or as an IV bag. And I also offer ozone therapy, which helps to enhance detoxification and energy by you breathe in concentrated oxygen. Basically, it's O3 rather than O2. Another couple of cases. And that's it. Thank you so much for joining me. And here's the list of the some of the products that I talked about from Douglas Labs. And see you at my clinic if possible, or online for an online consultation if you need help. Thanks, everybody. Have a great evening.